Hey guys, it's Dr. Tiffany here. So today's topic is on sleep enhancement. So don't fall asleep on me. I'm going to make it really quick today. So what's the difference between being sleepy versus tired? Well, sleepy is when we show the telltale signs of sleepiness, and that could be nodding off or yawning, right? Or tired. Tired is very different. So, tired is like we're physically fatigued. Maybe we just got done doing a dance workout. Maybe we are done with an aerobics class, or even going to the gym. Maybe we're done studying and our brain is absolutely fried. So, that's tired. I say you should go to bed when you're sleepy, not when you're tired, okay? So I remember when I was at the beginning of my marriage, I always wanted to make sure that my husband and I had the same bedtime. Oh, how sweet, so we could cuddle, right? But no, I was forcing him to go to bed when he wasn't ready. So he ended up being on his phone the entire time, and I know he didn't feel well rested because he was constantly stimulated by the blue light on his phone. So what I'm saying is, even for the young couples, let your partner go to sleep when they're sleepy. It could be earlier than you and it could be later, but we have to find this right sleep cycle for us, okay? So the next topic I'm turning to is called stimulus control and all the psychobabble we use, right? So basically, you should only use your bed for sleep and rodeo. You know what I mean when I say rodeo, right? I hope you do. Okay, we only want to associate our bed kind of like a sanctuary. We don't want to be doing our bills in bed, our homework in bed. We don't need to be watching crazy, scary movies at night in bed, okay? Because then our body starts associating the bed with anxiety, right? Okay, so now you get stimulus control. All right, we're going to go to the next topic. And the next topic is sleep restriction. That kind of sounds paradoxical, and it kind of is, but it really isn't. All right, so here it goes. If you're not asleep within the first 15 minutes of your head hitting the pillow, get back up. Do something low key until you feel sleepy again. When the onset of sleepiness comes on, then approach the bed and try and go to sleep. Again, if you're not asleep within those first 15 minutes, repeat the cycle as needed. You may be thinking to yourself, well, why am I doing that? That seems absolutely ridiculous. I'm really pushing back my bedtime. Yes, we're trying to find the right bedtime for you. If you keep pushing it back, guess what's going to happen the next night if you don't take a nap? You're going to fall asleep a little bit earlier. And the cycle continues, right? And we start to find a consistent sleep pattern for ourselves. It definitely works out. Consistency is key. You know, I'm super lame, even on the weekends. My toddler likes to wake up by about 7 o'clock in the morning, and I also like to write really early in the morning, so I usually wake up around, maybe 5 o'clock. And so I stay consistent. Even on the weekends, I'm so lame. I go to bed usually at the same time unless there's a really super duper special event. And if I go to your special event, you should feel really excited because I really am lame and I don't get out much. I like my sleep and I like for it to stay consistent, okay? So remember, if you're not asleep within the first 15 minutes, get yourself out of that bed. Do something low key, maybe you do like some kind of puzzle. Maybe you watch a movie that's low key, that's not like a Netflix thriller that keeps you going to the next TV series over and over again. I know binge watching can be absolutely addicting. All right. So now that you understand those situations and circumstances, it's important for me to remind you too. Obviously, alcohol before bed can help us fall asleep, but it causes us to have fragmented sleep. And that fragmented sleep is not restful sleep, right? So try and avoid the use of alcohol. Some of us like to use sleep aids, and sleep aids can be beneficial for a short-term problem that's not chronic, right? But if we constantly use sleep aids, we start building a tolerance, and then we start to believe that maybe we can't fall asleep if we don't have a sleep aid. So that might be a challenge too. I talked earlier about naps. Try to avoid naps. If you're really trying to start a really clean cycle for yourself, definitely try to avoid those naps, okay? So we do recommend if you absolutely positively have to take a nap, do it before 3 o'clock and try not to make it for more than 30 minutes to an hour. So that's what we recommend. All right, so last tidbit for you, and that's gonna be, do you find yourself getting better rest when you're sleeping at a hotel? Oftentimes some of us do. And if that's the case for you, you might think to yourself, well, maybe I need to change what my sleeping environment feels like for me. right? Maybe we need a cooler room, maybe we need a better mattress, maybe we need a better pillow, maybe I need to do something relaxing. Maybe it's the fact that I'm not inundated by a whole bunch of people when I'm in a hotel room. It's kind of solo time. So those are all the sort of things to reflect on. And of course, if you have nightmares, don't forget to go back to my nightmare vlog. Okay, I hope this was short and sweet and to the point, but do your best to stay consistent with that sleep cycle, and I guarantee you will definitely feel better and more well rested. Now, know that these behaviors, they're not something that we just change overnight, right? It's something that we have to practice. Eventually, our bodies will fall into a cycle where we used to go to bed at midnight, right? Now we're starting to fall asleep more at 10 o'clock. The reason why I tell you to get out of bed after about 15 minutes is because I don't want you to create an anxiety for yourself about sleep, right? Oh my God, today's going to be an awful night because I'm not getting a good night's rest. You start thinking and catastrophizing all of these issues in your mind. It's almost like I tell you, whatever you do right now, don't think of a pink elephant. You're going to think of one. You just can't help it, right? So I don't want you going to bed and start thinking it's going to be a bad night and elicit that anxiety. So that's why we say 15 minutes, and if you're not ready to fall asleep and you don't, keep repeating the cycle, because consistency is key. All right, so I promise you that's it. If you have any questions, comments, or concerns, please put them down at the bottom. If I think of anything else that I forgot, I'll put them in the comment section too, as just a reminder for myself and for you. And don't forget to subscribe. Thanks so much for watching, and push the love forward.